with that, we're going to jump into the next talk. If you do have questions for Sandy and her team, they do have a table out there. But we're going to jump into the next question. Nasha Fitter couldn't be here. She is one of the founders of Citizen, and she also has a daughter with Lennox-Gastaut syndrome and a FOXG1 mutation. But she sent her wonderful partner, Ellie Brimble, who's going to talk about phase 1 of what we call the Learn from Every Patient database, which is really in partnership with Citizen. So thank you so much for being here, Ellie, and you can use that mic there, and there's your presence.
Hello. Can you hear me? Okay. Well, thank you everyone for allowing me to speak with you today. It's a real privilege and pleasure to learn from everyone in this room and all of the speakers today. As mentioned, my name is Ellie, and I'm here representing our entire team to share more with you about Citizen. So first and foremost, part of the reason for why we're here is that we all know that collecting data in rare disorders, and particularly a condition like LGS, is really challenging. So this is a highly variable condition, both in terms of the symptoms, how the condition progresses over time, and how it responds to different therapies. Within that, relatively speaking, this is a smaller condition, and so people are geographically distributed all over the country, all over the world. And most importantly, participation in research can be really challenging for patients and for their caregivers, especially if you need to travel to be able to do so. In certain studies, we're certainly seeing a change, which is fantastic, but sometimes there can be misalignment between stakeholders and what are the right research questions and research priorities. And historically, there's really been a delayed realization of benefits to participate in research for patients and their families. And so that's where Citizen comes into play, and our mission is that we hope to use the power of shared experiences to provide relief for patients and caregivers who are living with complex and rare disorders. We are a two-sided real-world data platform. So if you look on the left-hand side of the screen, this is representing some of the relationships that we've worked to develop in order to collect a comprehensive and rich clinical database around a whole host of rare disorders, including LGS. So you'll notice that there is genetic data here, medical record data, imaging and EEGs, surveys, and claims data as well. And then on the right-hand side, these are sort of what we're labeling the cure chasers. So how can we make that data accessible and usable to the people who are working to identify novel therapies and increase access to those therapies? And then, of course, square in the center is the patient and the caregiver, ensuring that the work that we're doing is in honor and involves and is a strong collaboration with the community. So really what we've focused on over the past few years is developing technology and procedures in order to collect data from the rich, unstructured parts of your medical records. So instead of working directly with codes, can we parse out the information that physicians are documenting in progress notes, in the results of key procedures, and translate that into a usable and research-ready data set? So how the process works is you can sign up to the platform, and when you do so, you can choose whether or not you want to provide your data to be included in a research data set. When you sign up, you can indicate which institutions or providers you've received care from in the past, and then we can collect those medical records from you, collect those medical records on your behalf using the HIPAA right of access. Once those records are uploaded, we start to process them and remove some of the extra junk that tends to come along. And then we have a team of clinicians who go through and annotate information and then review that data for accuracy. And the output is really a clean, structured data set that can power questions that are important to a spectrum of data users. One thing I want to highlight is that Citizen is really a mission-driven company. Many of us are directly tied to the rare disease community or are living with a rare disorder or caring for a rare disorder, and so this is really central to our ethos. So first and foremost, patients are our partners. All Citizen users are the owners of their data, and you have full control to direct how and when that data is shared. When we collect medical records, collect data, annotate data, all of that data is presented back to you in your portal so that you can use that for your own clinical care. One other thing that we've been really excited about is that our business model also supports the concept of revenue sharing. So should you choose to participate in a study with industry or biopharma, any revenue that Citizen generates from that engagement is shared back both with the patient advocacy organization and with individual patients as well. In terms of research ethics, de-identified data is only shared with your express consent, and researchers are required to demonstrate to us that their research questions are consistent with what you've consented for. And then lastly, all use of the Citizen data needs to be reviewed by an IRB to ensure that the design of the study is ethical as well. In terms of where we are today and what we've accomplished so far, we've really worked to establish a broad network across the United States. And so you can see on this map, each of these dots represents an institution or a provider that we've collected medical records from. So this is more than 3,000 institutions at this point. As I mentioned, this is not just the paper records that we're collecting, although that represents a good majority. Some institutions are still mailing us boxes of records, if you can believe it. But this includes imaging, EEG tracings, genetic test reports, any specialty laboratory testing that you may have had sent out to a different institution and then scanned back and uploaded into your portal. That's all included. And then what I'm sure is no surprise to those in this room, complex disorders require complex management. And so this platform really allows you to follow your journey from start to end. And so on average, we're collecting data from about 5 or 6 different institutions per individual. In terms of then what we do with those records, we work to extract data that is relevant to the research questions that support our mission. So first and foremost, we pay a lot of attention to the phenotypes or symptoms that are documented and described for individuals. So this can also include things like developmental outcomes and seizure frequency, as well as growth. In terms of diagnostics, we focus a lot on understanding what types of procedures are being performed, but also what are the results of those procedures. So genetic testing, any imaging, electrophysiology like EEGs, and whether any laboratory or pathology studies have been done. And then in terms of interventions, we want to help the community and researchers in this space understand how are these conditions being treated. We know that it's highly variable, and we will in some ways want to be able to quantify that variability. Are there any therapeutic diets, such as the ketogenic diet, that are being administered? And can we start to understand whether those are effective more or less than other therapeutic strategies? And then also looking at things that we've talked about here today, like surgeries and devices, as well as hospitalizations. And really the purpose of generating this rich, long-term clinical data set is to be able to power patient-centric questions. So we work with patient advocacy organizations who have questions about their community. So understanding who is in the community and being able to track where they are in various research programs. Starting to be able to characterize different disorders. So what are the most common genetic causes of LGS, for example? What specialty care does my community need? We can then move into more work focused around advocacy, both to sponsors and also to agencies. So how can I best illustrate the burden of disease? And how do I demonstrate that there is a real unmet need for me and for my community? And then lastly, looking at outcomes and hypothesis testing. So there are many examples of this, but for example, how do seizures impact development? How does genetic testing or access to genetic testing impact outcomes? So really the opportunities are endless, and we really wanted to generate a data set that could be flexible in how it's used. Again, to emphasize, when data is shared, regardless of whom it's shared with, that could be an academic researcher, industry, a patient advocacy organization like LGS Foundation, all of the users of that data are making a commitment to protect the privacy and security of the participants. So in terms of privacy, again, de-identified data is only shared with your consent, and all recipients of the data make a promise that they will not attempt to re-identify the data. All protocols are reviewed by an institutional review board and also by ourselves when they're received. And both Citizen and any users of the data make a commitment to the secure storage and transmission of that data. So where are we today in terms of the LGS community on the Citizen platform? We actually had our very first patient with LGS enroll back in 2020, and since then we've seen a steady increase. Today we're at over 200 individuals with an LGS diagnosis, and we hope to continue to grow that number so that we can increase the representation of this community within the Citizen data. In terms of who those individuals are, we have a number who do not have a genetic etiology, but we also have a number who do have a specific genetic diagnosis that explains their LGS. You can see the spectrum of them here. We have a broad array, and we're continuing to try to expand, again, to increase the representation of the data. And so if you're interested in learning more about Citizen, the types of researchers that we work with, and how the data can benefit you in your life today, we have a booth here, so please feel free to stop by. We're happy to answer any questions that you have. And this is, again, a real opportunity to work directly with you and to enable research that's powered by the LGS community. So thank you very much, and I'm happy to answer any questions if you have them.
You're getting a cheering, glowing applause back there from our good LGSer friend. We have a question in the back. Do I have another mic runner here, or is it just me again? Oh, we got 2 questions in the back. All right. 3. All right. I saw yours first, and then I saw you next. Yep, great. Here you go.
Hi. Super interesting. Have you considered, I don't know if you're familiar, for example, with Gene Matcher? It's kind of like an application that kind of like pairs people with the same mutation. So considering that you are going to have kind of like a LGS population and you will have specific markers for each of those patients, have you considered including that possibility to be able to kind of like to match different families, considering how heterogeneous this is, you know, and so it would be kind of like a valuable thing for families maybe?
It's such a great idea, and it's something that we're planning to focus a lot more on the second half of this year. Something that we think is really interesting and unique about our platform is that because there is such a broad array of groups on it, we can help connect families who are experiencing the same sets of problems and symptoms and challenges, even if maybe they don't have the exact same diagnosis. So I love what you're thinking, and we're definitely working to do that and do more of that, so stay tuned.
I'm curious if your data includes Canada as well, or is it just limited to the U.S.?
It's another great question. So currently we're limited to the U.S. because we have specific laws and regulations in the United States that we can leverage to kind of bang on doors at institutions. But we're setting up a pilot in Canada that we will probably kick off in the beginning of 2025. And so if that's something you're interested in, feel free to let us know and we can work with you directly there.
Okay, thank you.
I'm curious if you include the data from before the diagnosis.
Yes, that is...
Because it asks the age of diagnosis for the data.
It's a great question. I think in our new onboarding, that may go away. Sometimes that's just helpful information to have to share as we're working to collect the records. But in terms of when we collect from, we make requests for records back to birth. So we're typically also including the birth hospital as well. In terms of the regulations, institutions are only required to save records for 7 to 10 years. What we're finding with a lot of pediatric hospitals is that they tend to actually store them much longer. They just keep them off site, so it takes a little bit longer for us to collect them. But on our platform right now, the average age is about 9, and the average duration of records we have is about 8.5. So we're doing a pretty good job at going all the way back to symptom onset, even if diagnosis is happening a little bit later. All right.
One more right in the middle there, yes.
Do you have an age that you're looking to collect medical records from? Like my daughter's 24, so I'm guessing you might not be able to get those early records. And then also, like, if they had infantile spasms, is that going to be something specific that you're looking at?
Excellent questions. We really try to welcome everyone, and particularly in adults. What life is like for adults living with rare disorders is relatively understudied, and so we certainly want to be able to enable more of that work. Basically, we do around 3 or 4 rounds of record collection and pushing back on institutions to get as much as we can. We have a number of individuals in their 20s, 30s where we were able to get the full record set for them, so it's worth trying. And then in terms of infantile spasms, absolutely. Even if, we see a number of individuals who, present with kind of neonatal focal seizures and then go on to develop infantile spasms and then go on to develop LGS. And so we really capture all of that to be able to understand the evolution of these conditions over time.
Great. Thank you so much, Ellie. That was fantastic.